Now we will discuss normal puerperium. Puerperium is a period following labor during which involution of the genital organs occur. At this time, these organs return to its preconceptual stage. Some texts classify puerperium into 3 stages. Immediate puerperium means the first 24 hours after puerperium, during which the most serious obstetrical complications occur, like postpartum hemorrhage or the post-anesthetic complication. Secondly, early puerperium means the first week after labor, and late puerperium after the first week till the end of the 14th day. Involution is a process whereby the reproductive organs return to their non-pregnant state. Reproductive system changes immediately following delivery. The uterus becomes firm, retracted, with alternate hardening and softening. The uterus measures about 20 centimeters in length, weight about 1 kilogram. At the end of the first week, it weighs half kilogram. By the 6th week, it weighs approximately 50 grams. The placental side contracts rapidly, presenting a raised surface which ensures about 7.5 centimeters and remains elevated even at the 6 weeks, when it measures about 1.5 centimeters. The lower uterine segment immediately following delivery, the lower uterine segment becomes a thin, flabby, collapsed structure. It takes a few weeks to revert back to the normal shape and size of the isthmus. This is the shape of the cervix in non-gravid women, and after labor it becomes slit-like. Physiological considerations. The physiological process of involution is most marked in the body of the uterus. Changes occur in all structures, muscles, blood vessels, and endometrium. During puerperium, the number of muscle fibers is not decreased, but there is substantial reduction of the myometrial cell size. Withdrawal of the steroid hormones estrogen and progesterone may lead to increase in the activity of the uterine collagenase and the release of the proteolytic enzymes. Blood vessels. The arteries are constricted by contraction of its wall and thickening of the intima, followed by thrombosis. New blood vessels grow inside the thrombi. Fibrous tissue in the wall undergo hyalinal degeneration, and the products are removed by macrophages. There is also degeneration of the elastic tissues. The endometrium, the superficial layer, becomes necrotic and sloughed in the lochia. The basal layer adjacent to the myometrium remains intact and is the source of new endometrium. The endometrium arises from the proliferation of the endometrial glandular remnants and the stroma of the interglandular connective tissue. The endometrium, by the 10th day, regeneration of the epithelium is completed. By the 16th day, the endometrium is restored. At about 6 weeks, the endometrium of the placental side is restored. Placental site involution. Complete extrusion of the placental site takes about 6 weeks. When this process is defective, late-onset puerperal hemorrhage may ensure. Size of the placental site immediately after delivery approximates the size of the palm, but it rapidly decreases after that. Placental site involution within hours of delivery normally consists of many thrombosed vessels. By the end of the 2nd week, 3 to 4 centimeters in diameter. Williams described placental site involution as a process of exfoliation, which is in great part brought about by the undermining of the implantation site by growth of the endometrial tissue. This demonstration shows the size of the uterus or the uterine involution after labor at the umbilicus at the first day. 2 days after it regresses downwards, and at the end of the 7th day it becomes at the level of the symphysis pubis. Vagina takes a long time, 4 to 8 weeks, to involute. It regains its tone, but never to the vaginal state, to the virginal state. The mucosa remains delicate for the first few weeks, and submucous venous congestion persists even longer. Logea partially reappear at the 3rd week. The introitus remains permanently larger than the virginal state. Abdominal wall, as a result of rupture of elastic fibers in the skin and the prolonged distension caused by the pregnant uterus, the abdominal wall remains soft and flaccid. It takes several weeks or even 1 year to return to its normal state. The lochia or the lochia, it is the vaginal discharge for the first 14 days during puerperium. The discharge originates from the uterine body, cervix, and the vagina. It has got a peculiar offensive fishy smell. Its reaction is alkaline, tending to become acidic towards the end. Its color, at the first it is red due to admixture with blood, then it becomes yellowish, becomes called lochia cirrhosa, and lastly becomes white, becomes lochia alba. The red take about 4 days, the yellowish about 5 days, and the white about 5 days. The amount in the first 5 to 6 days, it is estimated to be 1/4 of a liter. Normal duration extend up to 3 weeks. Persistence of lochia or excessive amount means subinvolution of the uterus. When it is extremely offensive, this means the occurrence of infection. In severe infection of septicemia, the lochia is scanty, not offensive. The period of time the lochia can last varies, although its average approximately 5 weeks. General physiological changes, placental hormone, insulinase enzyme causes the diabetogenic effect of pregnancy, becomes reversed, and so most of the cases of diabetes improves after labor. Estrogen and progesterone level decreases markedly after expulsion of the placenta, reaching their lowest level 1 week postpartum. The estrogen level in non-lactating women begin to increase by 2 weeks after birth and higher by postpartum day 17. The pituitary hormones, lactating and non-lactating women differ in the time of the first ovulation. In women who are breastfeeder, prolactin level remains elevated till the 6 weeks of after birth. Prolactin level declines in non-lactating women, reaching the pre-pregnant state by the 3rd week. Menstruation and ovulation. If the woman doesn't breastfeed her baby, menstruation returns by 14th day following delivery in about 40 cases. In non-lactating mothers, ovulation may occur as early as 4 weeks, and in lactating mothers about 10 weeks after delivery. A woman who is exclusively breastfeeder, the contraceptive protection is about 90% up to the first 6 months. After that, the conception can occur at any time. However, ovulation may precede the first menstrual period in about 1/3 of cases, and this is possible for the patient who becomes pregnant before she menstruates following her confinement. This means that before the first practice of coitus, there should be a method of contraception. Non-lactating mothers should use contraceptive measures about 6 weeks, and lactating mothers 6 months after delivery. Urinary system. The urinary bladder becomes edematous, hyperemic, and shows evidence of submucous extravasation of blood. Because of relative insensitivity of the raised intravesical pressure due to trauma sustained to the nerve plexus during delivery, the bladder may be over-distended without any desire to pass urine. Dilated ureters and renal pelvis return to normal size within 8 weeks. Blood and fluids diuresis becomes evident immediately after delivery, and it is responsible for loss of weight, which occurs immediately during the first week after labor. Rapid reduction occurs so that blood volume returns to its normal pre-pregnant level by the first or second week after birth. The white blood cell count sometimes reaches higher levels, with the increase predominantly due to granulocytes. There is a relative lymphopenia and absolute eosinopenia. Normally, during the first few postpartum days, hemoglobin concentration and hematocrit value fluctuates moderately. Blood volume returns to the normal level by 1 week after delivery. Cardiac output remains elevated for 24 to 48 hours postpartum and declines to non-pregnant values by 10 days. Heart rate changes following this pattern. The GIT, digestion and absorption, begins to be active again soon after birth. Bowel sounds are active, but passage of stool through the bowel may be slow because of the still present effect of relaxin hormone on the bowel. Bowel evacuation may be difficult because of pain in the episiotomy and may reflects constipation or hemorrhoids. Weight loss, rapid diuresis, and during the 2nd and 5th day after birth result in weight loss of about 2 to 4 kilograms, in addition to approximately 5 kilograms lost at birth, which is the weight of the baby, placenta, and amniotic fluid. Look here follows, responsible for 1 kilo blood loss. Total blood loss is about 8 kilograms. Additional weight loss depends on amount of weight gain in pregnancy and active measures to reduce weight. the ligamentary system, stretch marks in the woman's abdomen still appear and they may be even more prominent than pregnancy. Excessive ligaments, excessive pigment on the face and the neck and on the abdomen, barely detected in 5 weeks' time. Diastasis recti or separation of the rectus muscles and weakness of the abdominal wall if present, the area will be slightly indented. Abdominal wall and the ligaments requires 6 weeks to start to return to its normal size, and it takes about 1 year to reach to its pre-pregnant state. Lactation, since midwife through pregnancy, she has been secreting colostrum, a thin watery protective secretion. She continues to extract this fluid in the first 2 postpartum days. On the 3rd day, her breast becomes full and feels tense and tender, and milk forms within breast ducts. When breast milk first begins to form, the milk ducts becomes distended. The nipple secretion changes from clear colostrum to the bluish white and typical color of the breast milk. This feeling of tension in the breast on the 3rd or 4th day after birth is termed primary engorgement. Vital signs changes, temperature. A woman may show a slight increased temperature during the first 24 hours after birth. Occasionally, when a woman's breast fills with milk on the 3rd or 4th postpartum day, her temperature rises for a period of hours because of the increased vascular activity involved. The pulse. After the initial tachycardia associated with the stress of labor and delivery, bradycardia often develops in the early puerperium. A woman's pulse rate during the postpartum period is usually slightly slower than normal. This increased stroke volume reduces the pulse rate to between 62 and 70 beats per minute. A diuresis diminishes the blood volume and causes blood pressure to fall. The pulse rate increases accordingly. By the end of the first week, the pulse rate will have returned to normal. Blood pressure, systolic and diastolic blood pressures remain unchanged for the late pregnancy values until about 12 weeks after labor. Within 2 weeks postpartum, systemic vascular resistance increases by 30%. Thank you.